Hello everyone, this is Sangeetha, Assistant Professor, EC Department, SNS College of Engineering. So in this video, we are going to discuss about moral autonomy. So autonomy means self-determining or independent. So moral autonomy is the ability to think critically and independently about moral issues and apply this normal thinking to the situations that arise during the professional engineering practices. In other words, moral autonomy means the skill and habit of thinking rationally on ethical issues based on the moral concern. So it refers to the capacity of an individual to make their own moral judgments and decisions independently based on their own principles and reasoning rather than merely following the external authorities, rules or social norms. It involves the freedom to determine what is right or wrong for oneself, guided by the personal ethics, beliefs and values while taking responsibility for the consequence of one's actions. So the factors that influencing the moral autonomy are: first one is atmosphere in which the person is brought in childhood, and the next one is one's relationship with friends, neighbors and relatives, and third one is one's family structure and the family's economy, and fourth one is influences of religious and educational institutions, and the next one is influence of teachers and other mentors, influence of media like newspaper, novels or televisions, movies, etc. And the last one is influence of some social events. So the importance of skill required to improve the moral autonomy for engineers. To improve the moral autonomy given by the McMartin and Roland is as follows: the proficiency in recognizing moral problems and issues in engineering, that is, the skills required to identify and to differentiate problems related to law, economics, environment, society, or religion. So the skills required to improve moral autonomy is sensitive to valid difficulties and delicacies, that is, the sensitivity to other views, problem and sufferings, and adequate knowledge to the use of common ethical language so as to support or defend one's moral views with others. The next one is the ability to understanding the importance of maintaining one's moral integrity in the science. Let us discuss this case study. Moral autonomy. For moral autonomy. So Sarah is a medical researcher working on a groundbreaking treatment for a rare genetic disorder. Her research team has been testing the treatment on animal models and recently received approval to conduct human trials. However, during the animal testing phase, Sarah begins to have ethical concerns about the potential harm to the animals involved. As the human trials are about to begin, Sarah learns that the treatment shows promising results in animals but could have unforeseen side effects in humans. She is torn between her commitments to advancing medical science and her moral obligation to ensure the well-being of her research subjects. So the background of this case study is Dr. Emily Cotter is a respected oncologist with a long career in treating cancer patients. Recently, she has encountered a challenging ethical dilemma involving one of her patients, Mr. John Thompson, a 68-year-old man diagnosed with a terminal lung cancer. So, the scenario of this case study is Mr. Thompson's prognosis is grim with a life expectancy of only a few months. He has expressed a strong desire to end his suffering and prefers not to undergo aggressive treatments that would only prolong his pain. However, his family is deeply opposed to his decision, believing that he should pursue every possible treatment option. So the next case study is Dr. Cotter faces a moral and professional dilemma. On one hand, she understands and respects Mr. Thompson's autonomy and his right to make decisions about his body and treatment. On the other hand, she feels pressure from Mr. Thompson's family to continue aggressive treatment and feels conflicted about potentially going against their wishes. So, the moral anatomy in decision making. Respect for patient autonomy. Dr. Cotter values the principle of patient autonomy, which is fundamental in medical ethics. She acknowledges Mr. Thompson's right to make informed decisions about his own healthcare, including the decision to refuse further treatments. She believes that respecting his wishes is crucial for his dignity and well-being. And the next one is family dynamics and emotional pressure. Dr. Cotter is empathetic to the family's emotional state. They are struggling with the idea of losing Mr. Thompson and are inclined to the pursue every possible treatment option, hoping for a miracle. They understand that their perspective is influenced by their love and fear of loss. And the next, consultation with the ethics committee. So Dr. Carter consults the hospital's ethics committee to seek guidance on how to handle the situation. The committee advises her to continue supporting Mr. Thompson's autonomy while finding ways to communicate effectively with his family. And patients and family communication, that is in decision making process. So Dr. Carter arranges a meeting with Thompson and his family to discuss his treatment preferences openly. She provides them with detailed information about the benefits and drawbacks of aggressive treatments versus palliative palliative care. She listens to their concerns and emotions but reiterates Mr. Thompson's right to make his own decisions. So, in the decision making process, the Dr. Carter proposes a plan that focuses on palliative care to manage Mr. Thompson's symptoms and improve his quality of life. She ensures that Mr. Thompson's preferences are clearly documented and he is comfortable with the proposed care plan. So, Dr. Carter offers ongoing support to the family, helping them to navigate their emotions and come to terms with Thompson's decision. She provides resources of counseling and support groups to help them cope with the impending loss. So, the outcome is Dr. Carter successfully upholds Mr. Thompson's autonomy while addressing the family's concerns with the compassion. Mr. Thompson receives palliative care that aligns with his wishes, and his quality of life improves. The family, although initially resistant, begins to accept his decision and find solace in knowing that he received the care desired. So, moral anatomy is a critical aspect of ethical maturity and personal integrity. It enables the individuals it enables the individuals to make principled decisions based on their values and beliefs, contributing to a society where people are accountable for their actions and can coexist despite differences in ethical viewpoints. So it involves continuous reflection, courage, and a deep understanding of one's duties and responsibilities. Hope this video will help you to understanding the moral autonomy. Thank you.